Hello and welcome to another episode of Med Madness, where we break down complex medical topics into clear and understandable segments for our listeners. Today we're diving into the critical topic of cardiac tamponade. This condition is essential for medical students and practitioners to understand because it can be life-threatening if not recognized and treated promptly. In this podcast, we will cover what cardiac tamponade is, its causes, symptoms, diagnostic methods, treatment options, and a real-world case study to illustrate these points. Cardiac tamponade is a medical emergency where fluid accumulates in the pericardial cavity, compressing the heart and impairing its function. This fluid can be blood or other effusions and can result from various causes. Common causes include left ventricular rupture, cardiac surgery, malignancy, infection, and uremia. Understanding the pathophysiology is crucial. The fluid increases intrapericardial pressure above the diastolic pressure of the ventricles, restricting venous return and reducing ventricular filling. This leads to decreased preload, stroke volume, and cardiac output. Patients with cardiac tamponade typically present with the classic Beck triad: hypertension, jugular venous distension, JVD, and distant or muffled heart sounds. Another key feature is pulsus paradoxus, which is a drop in systolic blood pressure by more than 10 mmHg during inspiration. Symptoms may also include dyspnea, tachycardia, and shock. Physical examination can reveal clear lungs due to decreased ventricular filling rather than volume overload. Diagnosing cardiac tamponade involves a combination of clinical examination and diagnostic tools. An ECG may show low-voltage QRS complexes and electrical alternans. A chest X-ray can reveal an enlarged cardiac silhouette in subacute cases, but may appear normal in acute tamponade. Echocardiography is the gold standard, showing right atrial and ventricular collapse and inferior vena cava (IVC) plethora. These imaging techniques are essential to confirm the diagnosis and plan treatment. Treatment of cardiac tamponade focuses on relieving the pressure on the heart. Initial management includes intravenous fluids to increase right-sided preload. Definitive treatment involves draining the pericardial fluid through pericardiocentesis or surgical creation of a pericardial window. In cases of postoperative tamponade, urgent intervention is critical. Complications can include shock and cardiac arrest if not treated promptly. Lifestyle modifications and preventive measures are generally focused on managing underlying conditions that could lead to effusion, such as controlling infections or malignancies. Next, let's look at a real-world case study. A patient presents with symptoms of hypotension, elevated JVP, and muffled heart sounds after recent cardiac surgery. The patient also exhibits pulsus paradoxus. Echocardiography confirms a large pericardial effusion with right atrial and ventricular collapse. Immediate pericardiocentesis is performed, and the patient's hemodynamic status improves rapidly. This case highlights the importance of recognizing clinical signs and utilizing diagnostic tools for timely intervention. In summary, cardiac tamponade is a critical condition requiring prompt diagnosis and treatment. Key points include understanding its causes, recognizing clinical symptoms like Beck's triad and pulsus paradoxus, and utilizing diagnostic tools such as echocardiography. Early diagnosis and management are vital to prevent complications. Remember to engage with our pre- and post-podcast quizzes and use our Anki flashcards for effective study and retention of this important topic. Thank you for listening to this episode of Med Madness. Stay tuned for more insightful discussions on essential medical topics.